Well, hello and welcome to the Lunch and Learn session, Outsource Compassionate Care, How a Concierge Program Elevates the Patient Experience. My name is Bill Mills. I'm the CEO of Best Upon Request. We're a national concierge services provider, and I'm pleased to have with me a couple of my clients today, and I'm going to introduce them in just one second. Before we get started, I want to share with you our learning objectives for this session. Hopefully, by the end of the session, you will have heard from our panel how innovative health systems are leveraging professional concierge services to successfully elevate the patient experience, how concierge services create time and opportunity for medical professionals to work at top of license, how to integrate professional concierge services into patient care environments, and how concierge services and volunteer services differ and can coexist for greater impact. As I said, I'm pleased to have with me two clients of Best Upon Request, Catherine Berry Carter from St. Jude Children's Research Hospital and Michelle Kreutzkamp from St. Elizabeth Healthcare. I'd like to share a little bit about them, and so I'm going to read their bios for your information. Catherine has been at St. Jude for 23 years, and during that time has focused her career on the patient experience, including volunteer services, patient family-centered care, and guest services. She holds numerous certifications in volunteer management and most recently was certified as a patient experience professional through the Patient Experience Institute. Catherine is working at St. Jude and has spent much of her career there. A little bit about St. Jude. St. Jude is located in Memphis, Tennessee. St. Jude Children's Research Hospital is leading the way the world understands, treats, and defeats childhood cancer and other life-threatening diseases. Thanks to generous donors, no family ever receives a bill from St. Jude and for care, and no family is asked to pay copays or deductibles. St. Jude is a specialty research hospital, not a general children's hospital. Patient acceptance to St. Jude is generally based upon having a disease that St. Jude treats and studies and may be based on potential eligibility for an open clinical trial. Catherine, thanks for being with us today.
Thanks, Bill.
Michelle Kreutzkamp brings a wealth of experience to St. Elizabeth Healthcare. She holds a master's degree in nursing with 27 years of clinical nursing experience. Her rich and varied professional career has included overseeing Fort Thomas and Edgewood emergency departments and currently overseeing quality, safety, and accreditation over all 6 St. Elizabeth emergency departments. A little bit about St. Elizabeth Healthcare. Headquartered in Northern Kentucky and serving the greater Cincinnati area consisting of southeastern Ohio, southern Indiana, and northern Kentucky, St. Elizabeth has more than 10,000 associates and 1,600 physicians and advanced practice providers. St. Elizabeth has 6 hospitals and a host of clinics, labs, and physician offices throughout the tri-state area, and they serve patients from routine screenings to specialty services. Michelle, thank you for being with us today as well.
My pleasure.
And as I said, this is a learning session. And so I want to share with you just a perspective about Best Upon Request and our expectations coming into this Lunch and Learn session, having the honor and voice of our clients. So the goal of the session is to provide education and insights about concierge services to patient-family environments in healthcare. Questions that I ask during this panel are not intended to seek endorsement, and comments made by our speakers are not intended to result in endorsement of Best Upon Request and its services. Our purpose here is to share information with you that you may understand better how concierge services can impact a healthcare organization. Before we get into the crux of the conversation, I do want to share a little bit about who is Best Upon Request.
As a national concierge service provider, we have been providing professional customer services to our clients for well over 30 years. We partner with health systems and we partner with corporations to serve their employees as an employer-paid employee benefit. We also partner with health systems to serve patients and their family members and their guests. We work with emergency departments, labor and delivery units, and sometimes we serve entire hospitals or other areas of specialization. Our goal is to be a solution in the engagement and experience spaces within these organizations. And as a certified great place to work, simply put, our happy people are constantly working to make people happy. We partner with our clients to focus on the patient flow. We like to say the A, B, C, and D of patient flow, which includes admission assistance, bedside comfort, customer service, and discharge assistance. The icons that you see on the screen, Catherine and Michelle will go into great detail and give you multiple examples, but these are only examples. Our goal is to be a problem solver with the patient and for the benefit of the patient and the family. And so we come alongside to support them in a very personal way. Whatever the need may be, our concierges are going to look to find a solution to support them and serve them and help them to feel better cared for while reducing anxiety and stress in the process.
So without further ado, let's jump in. We'll start with Catherine. Catherine, again, thank you for being here. I'd love to ask both of you, describe your organization and describe the service line or the environments in your respective hospitals where concierge services are utilized.
Absolutely. I just first want to say thank you, Bill, for inviting me to join you on this Lunch and Learn. It's really my privilege to talk about how we conduct guest services in concierge at St. Jude. And our environment is really, it's very special. It's a hospital without walls, which basically means we share our information and our knowledge that we learn with the world. We say that we have a bench to bedside care model. So discoveries are happening in real time between what's happening in the clinical care side and the research side. We do treat all forms of childhood catastrophic diseases from cancer to HIV, all in between. I do think it's a really important distinction to say that we do not have an emergency room and we're not a typical children's hospital. We have an 80-bed license for inpatient. So our inpatient areas are on the smaller side of the scale, but we see 450 to 500 or more outpatient visits daily. Patients can also be with us for a long time, sometimes 2 years or more, depending on their treatment and the protocols that they're enrolled in. We do have housing units for our families to stay in while they're here. There are 4 of them. Infection control is a big deal to us. And so having our own housing allows us to better control that environment and keep our patients and families safe. Other interesting facts about St. Jude, oftentimes our caregivers who come, they don't have any mode of transportation. They're coming from some other part of the country, sometimes some other part of the world. And so while they're here, they don't have a car. They might be reliant upon our shuttles. And another thing to say is when our patients are on the bone marrow transplant units in particular, they can be there in isolation with their patient for as long as 6 months, where they're really stuck in that room and they can't leave the room. All of those challenges, all of those things, all of those unique facets of St. Jude really pushed us forward to establish a more formal concierge program. And here you can really see the footprint of the campus. It's very large. It's growing every day. Those areas in red are currently under construction now. The construction challenges that we are facing really present difficulty navigating the campus and definitely parking challenges for our families, our caregivers, our staff, everyone alike. We're in the downtown area of Memphis, and that also provides its own challenges. And you can't see from this map, but we do have those 3 offsite housing facilities. 1 is on campus, but 3 are off. And we do have shuttles that we provide that go back and forth to each of those housing units.
Catherine, thank you. It was a great sort of synopsis of St. Jude and the many things that you do to support families who come there. Michelle, love to have you speak to St. Elizabeth Healthcare, and you're actually representing 2 service lines. And so thanks for speaking for both.
No, it's my pleasure. I'm excited to be here. Thank you again for the invitation to talk about our concierge services and how they support us in our organization. Currently, we have our concierge service in our St. Elizabeth Edgewood Emergency Department. We see about 60,000 patients a year. We have a 54-bed emergency department. We've had our share of challenges with COVID and influx of patients lately, so it's been rather busy. And then also we have it in our labor and delivery service line. They just delivered 4,400 babies last year. So that's quite a bit. And with the labor and delivery service line, they cover maternal fetal, mother baby, NICU, and then obviously our laboring patients. And I think what's really unique is both of our service lines. This was new for us, for our organization, when with the concierge service. It was because, we were really looking at our why, what can we do to enhance our patient experience, and why do we need additional services? And so we were unique in one of the first emergency departments and labor and delivery to work with Best Upon Request in the concierge service to be able to enhance our patient experience while they're throughout our hospital stay. A lot of times our patients are coming in, obviously labor and delivery is a little different. Most of the time they're coming in for a happy experience and to deliver the baby. And so there's a lot of services from the beginning to end that we were able to manage care for. And in the emergency room, they're coming in because they had a life-changing event or having pain and a lot of anxiety. Unknowns come with an emergency room visit.
Thank you, Michelle. You may have said this, but just to bring some clarity, the St. Elizabeth Edgewood Hospital is your flagship hospital, and
correct.
The concierge service, two separate services, both Best Upon Request, but we have one dedicated service in the emergency department, one dedicated service to the labor and delivery or the family birthplace. And so can you talk a little bit more about the why your organization chose to adopt concierge services?
Yeah, first we looked at it as a patient experience. So first we had our concierge service in the emergency department. I was a brand new manager. I just came from our Fort Thomas campus, as you renew my bio, to come manage our, what we call the mothership, which is our largest hospital campus. And to be honest with you, I was taken back a little bit. I got called up to a boardroom meeting and they said, hey, we're going to bring in this concierge service. Your scores are kind of low. We need to figure out what we're doing with the patient experience. Where can they help us? And I'm like, I don't need, I felt, to be honest with you, I was a little taken back because I didn't want them at first, because I thought, give me a chance. I'm a new leader to this. I was excited about the opportunity. I knew where we were as far as our patient experience went. I knew what we needed to start to work on. In the back of my mind, I thought I had everything pretty much ready to go. And then I got hit with, no, we're giving you a concierge service and we need to figure out how to make it work. And so I had to take a back seat and say, okay, I'm going to have to make this work. And how can we do this with the concierge service? How is the staff going to adapt to this change? What are they going to do? But how is it going to impact the emergency room? They're shorter stays. We don't have the long stays like at St. Jude. Sometimes they might be a little longer than we anticipate them being there, but for the most part, an average, time in the emergency room is about 6 hours or less. So how is that all going to impact us? So when we got to sit down and work, we actually started from the ground, which was awesome. So we're like, okay, what can they do? And I think Bill mentioned that at the beginning, they are able to help us differently within what our volunteers were doing. Our volunteers are, which we'll talk about a little bit more, task-oriented, where Best Upon Request really focuses on the comfort care of our patients and our visitors. As nurses, we're hands-on medical. We want to jump in, start lines, talking to them about that. And then we're out the door to the next patient. But now this patient's sitting there with these fears and this anxiety. And now they're like, what do I do? And then Best swoops in and says, hi, I'm Best Upon Request. I'm the concierge service. What can I help you with today? And they're able to say, I'm worried because my mom's in the waiting room and she hasn't been back yet. Or, my sick elderly patients at, family members at home. And so I guess, and I probably went a little bit too far on that, but I think it's just important to know that the working relationship at the beginning, I felt very taken back and wanted to know, but then we had a meeting, 6 months later, Bill, and I sat in that conference room and said, okay, I'm taking everything back I said 6 months ago. It's been a blessing. It is something that I don't think we realized we needed until we had it. And now I don't know that we could live without it. The why is really for our patients and our families. That's why we added another layer in there, that we were missing a component and we didn't know what we were missing until we had the service come and help us.
Michelle, you said, you used the word, the concierge swoops in. do you think, and you mentioned that your executive team said, we want to do this, and they handed you the resource, and your response, I think any great leader is going to go, I can do this. I don't need it. I don't need additional supports. I'm going to go figure this out. So that's an admirable position, I think, for you to have taken. But do you think it's possible that the executive team could imagine we need somebody to swoop in and take care of these personal challenges?
I think so. I think we heard a lot from our patients and families. We got a lot of feedback from our patient experience scores, and a lot of it came down to care and comfort and things that we're just so task oriented, and sometimes we miss the boat on some of those things. And I think that's where they're hearing in the back of the mind. And then when you're able to provide that service, and I'm not saying we're not caring and compassionate folks, we really truly are. I don't want it to come across
Of
that way.
course.
But I think having an extra layer of rounding that, hey, you've been here, for a long time. Do you need an extra warm blanket? Or can I get you, your family's been here now for 5 hours. Can I get them something to drink? Things that, we're so task oriented that they really help us focus on, the individual and the stressors and the other things that the family's struggling with while they're there.
Thank you. Catherine, can you talk a little bit about the why at St. Jude and how that came about?
Sure, absolutely. Our CEO, Dr. Downing, he is incredibly passionate about making patient experience a priority, and he's very, very supportive. I've heard him talk about stories of standing in his office and looking out the window down to the parking lot and seeing families struggle with transporting belongings to and from their car and to the hospital. We all know how difficult it is to navigate any healthcare system, and St. Jude is no different. It's very challenging. And I think with his support, he really challenged us to think about, how could we have better compassionate care for our patients and families? We think we do it well, but how could we do it even better? And so I think with that charge, we were really able to think about, well, what could we do? What more could we do? And so I know in the beginning, I've had guest services for the 23 years that I've been here, but it's been basically focused on the main two lobbies. And so having this directive from our CEO just kind of, again, it gave me the luxury to just really think broadly and bigger than I'd ever been able to think before, and allowed me to have more resources. And so for us, the vision for concierge services really began with, well, what do our patients and our families want? What do they need? What are the pain points for our staff, and how can we really alleviate some of those perhaps with a concierge program? So we had lots of focus groups. We had lots of meetings with staff, with key stakeholders, and we learned a ton through that process. I think I said before, but the number one thing is parents don't want to leave their child to go out and run an errand or get something that they might need. And as a result, I think that parent mental health and well-being suffers, because they can't, and not leaving the bed, they don't go back to their housing to get new clothes or do laundry or, just the basic necessities of life. And so they were kind of going without and really struggling, and to have a healthy patient and to see our patients improve, the families, they need to take care of themselves as well. And so that was kind of another big drive for our concierge program is, well, how can we help caregivers? But then the other aspects of it are patients. They, in cancer treatment, the taste buds do funny things, and maybe they get really tired of our cafeteria food and they want something special. They just want a run out to the local fast food store. And so we envisioned, like, could we have a program that did that? Could we have some kind of concierge program that actually went out and bought fast food, brought it back to that family, delivered it to their room? There's so many things that we could envision, I think, once we got going on dreaming about what our services could be. But I think overall, we really the vision was to have extra special customized services for our families that were flexible, that met their needs.
Thank you. Yeah, I'm kind of leading into the next question here, but I just want to make a statement that I've sort of stood in awe for many years now with both of your organizations, and the caring that starts at the very highest level within your organization. your executive team and their focus. And so when I think about an organization, a healthcare organization partnering with a concierge service, I think it is so critical that senior leadership, executive leadership, they have to be on board with it. They have to embrace it. They have to promote it and support it. And that's what makes for a great partnership from Best Upon Request standpoint, but it's ultimately driving the result that you're looking for. And so, again, your organizations are pioneering in that they've adopted concierge services to do what you've been describing. I see the two of you as pioneering leaders because you took a resource that really, I mean, we have our own scoping strategy, but you both took a resource that had no definition in the beginning, and you made it yours. You embraced it, you made it yours. But that wasn't easy. And so I wonder if you could each talk briefly about the struggles, the challenges associated with adopting concierge services. And Catherine, would you like to go first?
Sure. I mean, I think I alluded to this, but I think our first challenge was creating a really solid that business plan and sort of the program parameters. And we knew we wanted, to engage a concierge program that could come. We wanted something that could be quickly off the ground, that didn't take a huge amount of time to have to plan, establish, and figure out how to operate. And I mean, I was an expert in guest services in the lobbies, but something like this was not my expertise. We also knew we have this little unique thing at St. Jude. We're a nonprofit, and we don't bill our patients, our families, for the care that we provide. But there's this little nuance where we were concerned, and I think one of our challenges in the beginning was how to reconcile, how do we have families reimburse us for the goods? So that was a big challenge for us. I think in thinking about insurance and liability and the risks of having an employee of St. Jude drive their vehicle, or even a St. Jude owned vehicle on behalf of, while running an errand, that was a big challenge. For how were we going to address those risks? We talked about having employees accept payments for credit cards and dealing with money, and that opens up a lot more risk. And I've formerly operated the gift shops, and I remember those days. And so I was not real keen on returning to having to count out drawers at the end of the day and keep up with the audit process. So that was a big challenge and something we talked about. If I'm selfish, I think one of the big challenges was my time. I have a small team, and we do a lot of different things across the institution. And so for having the time to focus on developing this program and run it and day-to-day run it was a challenge, and something that we really were looking for help with. So I think overall outsourcing for us ended up being the answer to everything. And best, Bill, you guys have just been great. I think the way that you train staff and provide customer service has just been outstanding. And it's, again, from a time savings, from my perspective, it's nice having an employee come in and just be ready to go on day one. So I really appreciate that.
Awesome. Thank you. And Michelle, how about you? Talk about the challenges. And you mentioned your own personal journey of, I don't know that I need this resource, to fully embracing the resource. That's probably something that was existing with your staff as well. What are you doing, Michelle, bringing a service in here to do this stuff for us? Talk a little bit about it.
I think they were better about accepting it than I was. I think one of the things that we needed to do was, because it was new for us and we had teen volunteers, and then you have the nursing staff. So really we wanted to define what is their role in our emergency department, in our labor and delivery service line, versus what, like our other like what the nurse does with, in our we have clinical care techs and all that. So we really had to define their role. And that was really important. So we brought your team to our huddles at 7 a.m. They huddled with our staff. We introduced them to the team. We went over job descriptions, what they were going to help us with. They had a phone. We had them integrated. They hear the all pages. They know if there's something urgent going on in a room. So really just really inviting them to our team. So, like so they would sit in the break room with our staff for lunch. We had them coming to our huddles, and we just talked about like, what's working for you? What do you need from us? And really at the very beginning, for the first 6 months, it was like, okay, what do you think if we do this? And okay, that sounds great. And what do you need resources do you need for us to help you with that? One thing we realized right away, we needed phone chargers. We did not have phone chargers for our for our patients and our families, and that was a big ask. They came up with some great comfort care things that we needed. We had coloring books for kids, but we didn't have like other things. We ended up getting like earplugs and face mask and, other items in their cart. So they were great at helping us identify some of the needs that the patients and the families had that maybe we didn't recognize that they needed. So it was a true collaboration. It truly was at the beginning, just to figure out how they can be part of our team and welcome them part of our team, because it really was like, okay. And then, the staff are like, can they do this? And I'm like, no, they're not, like, they can't, like, they'll help directions with patients and things like that. But there's certain things that, that they really have stepped up. We have a lot of inpatient boarders right now, which are patients that are being admitted that are waiting to go upstairs. And lately they've been really great about like taking in the menus. Once the patient knows they have a diet, the nurse will call them and they'll take the time to go over the menu with them and call in their order and help them decide what they want. And they're actually great about recommendations and things like that. We can also feed the families on our guest trays. And if the family wants something to go out, they're absolutely doing that as well. And again, like Catherine stated, it's nice that we don't have to muddy the waters there. We provide the service, but if the goods are being paid for by the family or the patient, but they truly are part of our team. You can see here in the slide, a patient brought in Krispy Kreme donuts. So the Best Upon Request team brought them and shared them with all the staff and brought them in the back for us. But they're great. I think the biggest thing at the beginning on integration was what were our needs? We know we needed, we had some gaps, but for them to be there to help us identify those, and then we work together to implement some changes. And hopefully in a few slides, you'll see some of the changes we implemented. But I think that was really great working relationship at the beginning, because it was new for you all and it was new for us. And so we were able to partner together to make it work for what was best for our patients and their families.
Mm. And Michelle, you talked about, it takes us to the next conversation point, and you talked about that discovery process of what is needed. The way Best Upon Request views our work is we consider what we do is work at the soul level. You're providing clinical services, and a lot of healthcare systems have social services, but we're really getting personal with patients and their families. And the model that we use to identify where is it that we fit and what can we take from the nurse's plate or other caregiver responsibilities and own it for them so that they can focus even more on their primary role. We use a process called burdensome out of scope and the identification of opportunity. It's an innovation model, but we're looking for how can we impact the clinical service providers, the social service providers, and how can we really create this role in between where we are hyper-focused on the patient and the family members, the guests of the patient. And so when you see this model, when you think of that, you already touched on it a little bit, Michelle, but talk about what the service looks like for your organization.
I mean, it is. I mean, I think that they provide a lot to our patients and our families, both on the labor and delivery side and on the emergency department side. And you're right. We're focusing on the clinical side of things, task oriented and all that. And then they come in with, okay, what else can we help you with? What stressors do you have at home? I mean, I think they bring up a lot of things that, they're scared. These patients are scared. They're not sure what the outcome is or what's going on with them right now. We're still doing a bunch of tests. So I think just having that wraparound service. I mean, one thing that I love about our concierge service is they're our constant. And we've talked a lot about that. So we have, clinical care staff that are awesome, and they're focusing on all the tasks and the quality and the safety of our patients. But then you have your constant, which is our Best Upon Request team. And they come in and they know what we need from them. And it's so nice. And like Catherine stated before, you guys, the the people and the quality of the folks that you hire. They're the most compassionate, caring folks. And one of the staff members said to me just today, right before we were, is, you know, what I love about our Best Upon Request team, yes, they're awesome for our patients, but you know, they take care of us too. And they listen to our stressors and they help out our team. So it's another sounding board. I thought that was so awesome. Like, they really are our, you know, part of our team. They take care of this, you know, the patients and our families, but they actually take care of our staff too. And I don't think we always recognize that about them. But that was pretty impressive that they said that. And so, you know, I think their service is something that, like I said earlier on, I didn't know that we needed until they got into our family. And then we realized this is, yeah, something that's just been a blessing.
That's awesome. Catherine, how about you?
Yeah, I mean, concierge for us really addresses a lot of our gaps. We have a lot of services that we offer our families. Like I said, we have a housing facility for them. We may pick them up from the airport, but what about all those times in between? And, you know, when a family needs to go to the grocery store midweek and the shuttle's not running till Saturday and they really just need some milk and some bread. Those were gaps for us. When a family might have family coming in from out of town to visit them, where will they stay? They can't stay in our housing facilities. We do have some limitations there. So arranging a hotel nearby was a gap. Arranging entertainment for our families. We often hear, I'd like to take my patient to the zoo this weekend. Is there a possibility to get zoo tickets? And we were actually able to get some complimentary tickets from the zoo, and concierge has helped us implement that program and make sure that the families who need and want the tickets can get them in an easy way. We've also got things like, you know, because our families are here for a while, they get things that are actually mailed to the hospital and come to the mail room, which is clear on the other side of campus. So it's really nice to have a concierge team member who can go pick up things like care kits and gifts from home and bring them to the inpatient room, or even take them to their housing facility a couple miles off campus. I think I've heard a lot about, you know, our bone marrow transplant unit families in particular. If a mom is there with their child and they're stuck there for a good long while, a couple months on end, you know, you get a little stir crazy. But you also need basics like your medicine from the pharmacy, picking up any kind of special foods you might want. All of those things were gaps for us. We have a pharmacy, but it's for our patients, not our parents. And so how do they go to the local store and get their pharmacy if they don't have a car? I think a lot of times people come to St. Jude and they've just learned about their child's diagnosis, and they haven't had time to process or think. They just throw things in a bag and get here as fast as possible. And so it's really easy to forget your basic necessities. And again, those are, you know, things that concierge can help us do. They were gaps and concierge can help fill them. I think one of the things that's really unique to St. Jude is moving services, and concierge it's been a huge benefit for our families. That when they're inpatient, they tend to collect a lot of things, toys. You know, you can imagine if they're there for a couple months on end, in some cases, they do collect a lot of things, toys and gifts from home. And so when they're discharged, what do they do with all those things? And how do they get them from inpatient back to their room in housing? Well, concierge helps them pack it up and move it for them. In unfortunate situations where a patient has passed away, parents have gone home quickly and to make arrangements, and they left all their things in housing. And that's an awful thing to have to think about, packing up your things in a time like that. And so concierge has really been a wonderful benefit to be able to pack up all their belongings in housing and either mail them or hold them for them so that when they return, they can get them. That's been a real benefit.
Great examples. Thank you. Well, I'm sure a lot of people are interested in understanding the value of the impact. You've both given lots of examples let's talk a little bit about the impact. And Michelle, this is a slide from your data, and I want to introduce the data really quickly on your behalf to say that when you took over the emergency department and you were implementing many things, you adopted concierge services, you were putting other things in place that you knew that were going to be important. When we look at this data, what it basically says is that in the 3 years following your joining the emergency department at Edgewood, your flagship hospital, your overall satisfaction, your percentile score increased year over year. But I love the data at the bottom that says in 32 months, you had 25 scores that were top box scores as compared to your peers. 12 of those were above the 90th percentile, so tracking month over month results. So 25 out of 32 months, you had a top box score. Before that season, those 3 years, you hadn't had top box scores. That ED had not. This is a testament to your leadership and your organization, first and foremost. We have the luxury or the blessing of being a part of your growth and improvement and enhancements that you brought. But it is something that we're also very proud of. And, on the slide, we've shown that we were adopted, our service was adopted in the 4th month of the first year. And so that's a 3-year trend of your results as well as Best Upon Request contribution to your organization and the experience, the overall satisfaction of your patient families. When you think about results, and you've talked about that constant, are there other things that come to mind that the concierge, from a results standpoint, has sort of driven an impact for you?
Oh, absolutely. It's a team. We're definitely a team. We're here for the patients and their families. We wouldn't be as successful without them being there. I'm going to tell you, the familiar faces, it's nice when patients know that we have the concierge service and they've used them in the past. And so they're like, oh, Sandy, we're good to see you again. And, it's just like seeing another nurse. And so to be honest with you, we couldn't have done this if we didn't collaborate and do it together. And we learned together along the way. Like I stated before, this was new. It was a new service for us in the emergency room. It was new to you guys. It was a trial and error kind of thing. We had fun learning on what we needed and what worked. What we also knew what didn't work. We didn't have to travel out as much to go get food for individuals as much as we did. We thought big ask at first. Go get meals, go get like that. But like I said, a little unique situation because they're not there as long. And we do have cafeteria services, trays in the room, so they don't have to run as much. But then there was other things that they identified that we needed that we didn't know and that we had to get, like Catherine stated too, there's a lot of gaps that we didn't have, we have a telephone in the room, but you have to dial 9 and it's not close to the beds. And so we had to okay, how can the patients call out? How can I help them? So we have a phone that they can take into the patient's room and, just different things like that. Like I said, the phone chargers was a big one. And then we realized, how do we get them back? Because sometimes they would go with it. So they started just taking some kind of identification and then they would turn that in and get it back. So, but it's so nice that the nurses don't have to do that. They're taking care of the medical part of the patient. And so if you have to stop a healthcare professional and say, oh, can I have a phone charger? And you might be an hour later on getting it to them because you have something else in the middle. But Best Upon Request is a phone call away and you can say, hey, can you take bed 12 a phone charger? And then they're doing it immediately. Or, Six's family's really hungry. Do you mind helping them with the guest service tray? It just really has been a unique situation that we're able to work together as a team to fit the needs of our patient in all aspects, from us focusing on one aspect of it and then they're focusing on the care and comfort side. So it's been wonderful.
Well, you mentioned care and comfort. Talk a little bit about the activity of the concierge from a measurement standpoint.
So what you're looking at right now is a slide and where most of their time is spent. And if you look at this, so like I said, we see about 60,000 patients a year, but as you can see, they made welcome visits like 30,000. So that's how many touch points they had with our patients, which I love. When I first got the data from Best Upon Request, I was like, okay, how does this work? If I only saw 180 patients today, how did we have 250, or however many rounds on the patients, but I didn't have. Well, that's how many times maybe they were in a room more than once or more than twice. And so that was also unique data that we were looking at, is how many touches they had on our patients. And that speaks volumes to us too, because, granted, I might average 180 patients a day, but they might have had 300 plus touches in that day for our patients. And that's because they went in and offered a blanket, and then they needed to take them a phone charger, and then maybe another patient needed a tray ordered. So they're rounding and doing those kind of things. And so most of our time in the emergency room, they're spent on care and comfort, welcoming and rounding on the patients. Welcome to the emergency room. One thing, and I have to mention here, your team is amazing at managing us up. Hearing the best team manage up the nurse, so-and-so's your nurse today, they're absolutely awesome. I mean, that talk about making an impact on our patient experience, that right there does it. And your team does a great job at managing up. So
and Michelle, the sentiment that the feedback that patients share, there's the quote there that I'm sure everybody's had a chance to read, but you've got another page with a couple of quotes on it here. I wonder if you could, speak to the testimonials.
Yeah, so I think, it's great. Again, Sandy brought a patient a breast pump who was there with her dad. She didn't want to leave her dad's side. He, was critical. There was a lot of stuff going on, but needed to take care of some things. And so those are things that, your team is so in tune to, helping us, like, making sure we're getting. The professionalism and the kindness and compassion I've talked about with your team, they're absolutely amazing. Relieving some of the stressors, I think, is really important. Loved ones, like if you have an elderly gentleman is in the emergency room and his elderly wife's at home and he's their primary caregiver of that person, then best upon request can notify that nurse and say, hey, the wife's there alone. We need to look at additional resources for her while she's there. They collaborate really well with our team and our providers. We had a lady, and this is a great story. She was very stressed out. She's wheelchair bound, and this beeping was going on at her house, and she couldn't figure out what was going on. And Best had to go there to get her glasses for her. And she said, while you're there, can you figure out what this beeping's for? She thought it was her fire alarm, but she's wheelchair bound and didn't realize, had no means of getting the battery changed. Well, your Best team took it upon themselves and went ahead and changed the battery while they were there retrieving her glasses. And then they went back and told her, and she just, she was bragging about that. She called leadership. She just was so appreciative, because again, it's a stressor to her, and it might not have been that important necessarily to everybody else, but to that patient, that was an underlining stress for her. Where they have to leave their animals at home. Like, hey, you talked about the patient that was going to be admitted, wanted to leave AMA. A lot of times they want to leave against medical advice because they have pets at home, other loved ones they're caring for at home, children at home. And so being able to best to identify those and then work with us to be able to make sure that those stressors are getting relieved so that they can stay and get the medical care that they need is huge.
Thank you. We've got a couple of slides also regarding the family birthplace. So you want to touch on some of their data?
Absolutely. So I think you see a care and comfort is, again, one of the big impacts of that. Food services is a little different for labor and delivery. So those dads and moms might be a little hungry after delivery. So they do go out and make a little bit additional food service runs, especially because of the off hours. So that's really helpful. And if you want to go to the next slide, I think one of the things I want to focus on labor and delivery is this will call text messaging. I was so impressed when I heard about this. So Best Upon Request concierge services initiated in right at the beginning of pregnancy. So whether you're at your doctor's office and you find out you're pregnant, during like an ultrasound visit, or even during your first prenatal visit, they get an opportunity to share with you the services that we have at St. Elizabeth. Which I really think is neat is, and I didn't share this earlier, but our vice president at the time, she actually was looking at how can we be uniquely different in our labor and delivery. There's competition. There's labor and delivery services across the river. We're the only one in Northern Kentucky. So what can make us stand out? And we were talking about the best services in the emergency room, and our VP's like, how could this work for labor and delivery? I was pretty impressed because it's been a long time since I've had a baby. So it was been nice to have this, but the will call text messages I thought was awesome and you can see there's over 9,000 calls. And what they did is we took a couple Snapchats of like what this does. And what this is you can opt into this program at the beginning of your pregnancy. You don't have to wait till your delivery. You don't have to wait till your last trimester. You can opt in at the very beginning. And what's great about it is, what if you have a complicated pregnancy and you didn't know, and you opt into this, and they're sending you text messages like, hello, it's your patient concierge team checking on you today. Hope all is well. Let us know how we can assist you. It's just wonderful. And you can see on the testimony there, those are some real live text messages that they send out to the patients. And then I love the quote from the patients saying that they love the way that they checked on me several times a week to remind me that they were there for me and if I needed them. And so again, just another testament of just reminding them, opting in. You might think, oh, you know what, I really could use some help, but I didn't, now that you texted and reminded me, I'm now on bed rest and I wasn't 2 weeks ago, and maybe I could use some groceries, or I could use this. And so those things I think are awesome. And I love that will call text messaging service lines for labor and delivery, and you could see over 9,000. And the feedback has just been wonderful too.
Awesome. And there's one more slide with some feedback on it.
Yes, and you can read that. I think one of them, was at my house. They were out of diapers, without a way. So Best Upon Request went to the store for them and was able to get some diapers for them. That saved the day. Just thankful for the whole concierge service team. They made the recovery much easier. So it covers them up to 6 weeks postpartum. So that's the other unique thing. So from the beginning of pregnancy till postpartum, the best team is there to support their needs. And the feedback has just been wonderful. And again, it's unique. It makes us stand out from our competitors across the river. So that was kind of something that we wanted to look differently. And when you're the healthcare system, and we, like Bill said earlier, we're in Northern Kentucky, we're, it in our community. We need to make sure that we're providing services that are unique to our community, and we want our folks to stay in our community.
Awesome. Thank you, Michelle. Catherine, let's transition over to you. There are, again, it's so interesting how we've sort of covered the differences in the programs and the way that your facilities operate, but the results there are no less impressive, and the feedback from your families has been extraordinary as well. Tell us about this picture.
Oh, definitely. This is a special story. When we first brought concierge services, probably within the first month or so of operations, we got a call from this gentleman saying that he really wanted to propose to his girlfriend. And she was a former patient here at St. Jude, and he knew how dear St. Jude was to her and how it played such a role in her life. And so he wanted to propose to her here at St. Jude in the clinic and outpatient area that she spent a lot of time in, with the staff around her that helped treat her and care for her. So he called and he asked the how-to question, and I think he was really rather surprised, as was I, that we were able to just completely say, hey, let's take this over for you. And what would you like to see at the proposals? Would you like a cake? Would you like some flowers? How can we help arrange this so that it's a surprise to your new bride to be? And so the concierge team really made that happen, and it was truly a special event. There were no dry eyes around. We were all very pleased to see this. It was such a touching moment.
I'm underwatering a little bit now.
I know. I mean, it just really stuck with me, like, wow, this is, you can dream big, but this is far bigger dream than I ever thought, we would have with the concierge program. And it just shows you the uniqueness and the flexibility that the program offers in really helping to deliver that best in class, world-class service for our families. I mean, I think in 2022, what the data is showing is, 23,000 different services were provided to families. I think what really stands out to me too is the miles saved. Nearly 22,500 miles saved and time saved for our families. Those are miles they would have had to put on their car or call Ubers or Lyfts, and time going out and running those errands. And that makes a tremendous impact for our families. And on average, having 2,000 families enrolled is amazing as well. And you can see from the data, we generally see a lot of shopping. We see a lot of pickups, deliveries, groceries, all of those things where it's typically going out into the community and picking up something for our families and bringing it back to wherever they are across the whole system. So whether they're at a housing facility, or on campus, inpatient or outpatient, bringing things back to them. Really, really amazing, helpful. And I know something Michelle said really resonated. The care and the comfort rounding for us is big too. I mean, we have the concierge team rounding on all of our outpatient clinics and just asking, how are you doing today? Is there something I can get for you? Have you heard about concierge services? Do you know how to enroll? Here's how you can request services. And I think that's just been wonderful. Our families really enjoy having a listening ear. You can see from the quote there in the bottom left-hand corner, I've grown to love these ladies like my own family. I feel such a great comfort when they get everything that I need. I think that really illustrates it right there.
And there's a few more on the next slide here.
Yeah, I mean, goes back to their excellence in service training. They know our family's names. It's not just, patient mom. They know their names. They make the families feel very special. And I think that our families see them as more than just employees. They see them as family in a way. It definitely it's not easy to forget. They go home, and when they come back for checkups, I think we hear a lot of times, oh, I can't wait to see so-and-so on the concierge team. They treated us so nicely. They were one of the greatest assets of St. Jude.
As we round out the afternoon discussion, we want to talk about volunteers. We'd be remiss if we didn't talk about the contrast between what volunteers do and what a concierge service can do. And so I wanted to just ask both of you, starting with Catherine, talk about your volunteer program. You oversee volunteers at St. Jude, so this is a subject that is your daily life, Catherine, and so is concierge. So love to hear your perspective on how St. Jude makes great use of volunteer services as well as concierge services, and maybe what the contrast is.
Well, I think volunteers, they're able to do some tremendous things with our families to improve the patient experience. And they come to St. Jude because they want that face-to-face interaction with our families. But we realized in the beginning when we were developing our business plan that the type of duties that a concierge employee would provide would vary from what a volunteer could provide. We needed consistency and attendance all throughout the week, the same person there, which with a volunteer, they come in once a week typically. We really needed employees that were skilled and trained in customer service. Not that we couldn't train our volunteers, but again, having a program like Best Upon Request, an organization that had all that training already developed and could provide it with expertise was something that our volunteers could not do or could not receive that information. And we needed, people that could run errands and drive personal vehicles and really assume some of that risk for our institution, which a volunteer really couldn't do. We really needed somebody who could physically lift and tote and move things around and purchase items and accept forms of payment. And all of those things are just a little risky for volunteers. They infringe on some labor standard laws and other things that are just, not in a comfortable place for St. Jude. So for us, I think that they were two separate programs, but now they're very much in tandem with one another. And I definitely want to say from a positioning standpoint, having concierge services positioned in the same team with volunteers has been very advantageous.
You've got one additional slide here with some things that I think volunteers do in particular.
Yeah, so the Happy Cart is there on the left, and we have a lot of supplies that volunteers will deliver a couple of times a week, both inpatient and outpatient, but all those times in between, what then? So concierge will get those requests, like Michelle said, for charging cords are one of the most popular. I need a charging cord for my phone. And so the concierge team can come down to volunteer services. Our offices are very near one another. We can provide and help provide those needed services when there are gaps like that. So they don't have to run to the store. They don't have to charge the family for it. We've got it on hand. And so they're able to provide it. And same with the beverage cart at night, like we have frequently the beverage cart volunteers, we train them to tell the families inpatient, hey, there is a concierge services program. Do you know about them? And have you signed up? And here's how you can enroll. So there, again, there's a lot of cross connectivity and partnership.
Thank you for sharing that. And Michelle, this brings us to our last slide for the day. Talk a little bit about volunteers at St. Elizabeth and maybe the contrast of volunteers and concierge there.
So with the volunteers, a little bit different. And I think Catherine hit on it too. Your team is our constant. They're professional. They're there every day. Our teen volunteers are in and out. They're not our constant. They might be there one day a week. We might not see them for another month if something comes up. A lot of our teen volunteers, they're task oriented. So what they'll do is maybe empty linen bags, put blood tubes together for us, get our COVID swab packs together. So we give them task things to do. You can see the dogs and the pet therapy. So really with that, our volunteers, that's just as much for our staff as it is for our patients and our families. When they're in the hallways, our staff get that pet therapy and need that extra stuff from our volunteers just as much as our patients and our families do. I think it's nice to have the difference between the two. Like Catherine stated, they each are so supportive and valued in our organization, but it's just the difference on how they provide that service line to our patients and our families versus the other. And we were able to distinguish that. And that was one of the things that we learned. What is the difference and how do they do that? Again, the professionalism. You guys do all that training, like Catherine said, your expectations are there. We know the employees that we're getting. It would be very difficult to try to do that to mask numbers of folks. And there's no constant where your team is, they're this, besides a couple of people that float in and out to cover vacations, you have the same team there every day and every week. And that really makes a big difference, I think, to everybody on our team.
Thank you. I heard both of you say people, training, systems, and processes. And when you hire a professional service, you should expect processes and systems and methods for implementation and defining the scoping alongside your team. And all those are things that you touched upon. And I think it does help to contrast the difference, but I don't think any healthcare organization wants to survive without its volunteer corps. And
no, absolutely not.
These pictures are very inspiring. So thank you both for sharing. Well, that brings us to the end of our session. I hope that we have accomplished the learning objectives and that everyone who's participating in this or has listened in has benefited greatly from our time together. And from the three of us to you, best wishes and good luck this year. Thanks so much for tuning in.